Health Education Lecture Series. All the listeners of Health Education Lecture Series, I am your host Gurdeep Singh Sandhu, homeopathic consultant. My clinic address is 9701 Sarah N. Court, Dublin, California 94568, and the phone number is 408 687 1899. And you are listening Health Education Lecture Series, a lecture of history of life, how the life was created, how it was developed at different phases, what were the complications this life faced, and ultimately it developed. Life was stronger than the hurdles. It has already passed. It shows that if we are surviving, it means the life was stronger than the hurdles. There were many more hurdles. We know them as diseases, complications during the developmental phase in the mother's womb, and also after that, even after the birth, after when the child is separated from the mother, there are many more complications throughout the life. Since this life is still existing in this body, we have many more complications. By name of the diseases, we name now diseases. These are the complication hurdles in the normal go of life of life. So in this way, since beginning, since the combination of sperm and ovum, we are discussing all the things even before that, when how the ovum was developed, how the sperm was developed, where they are developing, how they are developing, then how are then they are transported to meet each other. Everything has been described in all these lectures, series of lectures, you can say, since many years. I'm discussing all these things. First of all, this was only related to the doctors, to the nurses, to the medical professionist as a whole, you can say. But the person generally in different fields of life, in the science, technology, and many other fields, but they do not know much about this body, how this body was developing, and how this body was created in the beginning, then life was continued. But with the technology, with the development of the knowledge, many of the technologists has advanced their knowledge up to the planets. They have reached to the planets, but they reached to the planets with this body. If you drive a car, if you drive a rocket, if you drive a aeroplane or any motor bus or whatever, you know about all those things which are working over there. And in case if there be any hurdles, any problems, any complication comes in between, and you are able to correct that. Or sometimes there are some other technicians, they can help you to start that one. This is the normal phase, normal things. But with this body, you are doing all the things in all the sphere of your life, science and technology. But we do not know much about this body, how this body was developed, how this body was facing the complications, and even then it is surviving, and what are the phases of its development, and what are the stages of this development. And all these things I am discussing in these lectures, and adopting all three languages. Main important language, the international language as English, Hindi language as an Indian language, Punjabi language as a Indian Punjabi areas. Most of the now basically the Indian language has become international as well, because the Sikh community or the Punjabi speaking community is not now limited to the Punjab only. It is now international community, and that is why this language has also an international level to it. Even Hindi, I cannot ignore that one, that Hindi is also developed all over, and most of the countries are there. Persons are there who are using, who are speaking, who are writing Hindis in their day to day life. In this way, the same thing is Punjabi. But overall, the English is concerned, English is known as the international language. So that is why to convey this message of life, to convey this message of nature, basically about this body, I'm using all these three languages. One day I deliver my lecture in English. The other day I'm delivering my lectures in Punjabi, and the other day in Hindi. In this way, one lecture is delivered three times so that every person who understand English and do not understand Punjabi, who understand Punjabi, do not understand Hindi or English, or any Hindi speaking persons who cannot understand English very well, they can understand about this life, how it was developed. And I want to make it simple, easiest way to understand. That is why I adopted all three languages, that every person who can understand any of the language which I am delivering lecture here can understand. So it is not only limited to the medical professionists, that they should know about the life, that should know about this body. And after developing the life, after developing this body, we are discussing about the structure of this body. When this fully developed, basically fully, we cannot say that it's fully developed, because up to end there are some changes which occurs time to time, just like after 50, 60 years of age, Z40 process is converted into bone, and the same way the appendix is also having a limited period, then it is dried up as a horn. And in this way, there are many more other things which continue developing, continue passing on their phase, continue passing on their functions, and ultimately they go off from the functioning periods, but they still remain over there in the different shape. So all these things I'm discussing time to time, and whatever is in my experience of 52 years of medical practice, out of which I was teaching in medical colleges for about 26 years, and after that, since I'm here in USA since 96, I'm delivering my lectures on different radios, TVs, radio stations, newspapers, and everywhere. Whosoever ask me to give me lectures, I uh, I feel proud that yes, they need lectures. I can give them free lectures so that they can join us, and their community who is listening, their radio, their TV stations, they can understand about this life. And nowadays, Radio Pravaz joins us. Previously, Radio Punjab was joining us, and before that, there was Radio Geet Sangeet and 1170 radio stations. So, various other radio stations were joining time to time and were delivering these lectures to their community, their listeners as well. Here, Radio Sabrang is running since 2012, and since 2012, regularly I'm delivering my lectures on this radio stations at different views, different diseases, and different phase of life. What happens? What are the diseases and concern to the different phase of life? All these things I'm discussing time to time, and then Radio Sabrang. And if ever you are interested in all these things, to listen about all these the previous lectures, yes, you can join my YouTube channel, upload this YouTube channel, or you can download the app of Sabrang radio station. Plus, you can be my friend on Facebook. And every day when this lecture starts from 5 to 6 p.m. California Pacific times, you can listen fresh lectures for each and everything which I'm describing about this body and about this life and functioning of this body, all these things. So in this way, till now, we have reached to the age from beginning onward, The life started from the uh, mm, meeting of sperm and ovum and the fallopian tube of the females, where it was a detailed lecture. So I'm just giving a short synopsis of all these things so that you can understand what chapters we have passed. And if you need the details of those lectures, again you can go to my YouTube channel and you can find out all these things again in simple language. You can listen in Hindi, you can listen in Punjabi, you can listen in English as well. So whatever language you want to. So in this way, we described about that one, and then we described about the life when it entered into mother's womb, from the fallopian tubes to the mother's womb, and ultimately, remember, I started it from the first day of menstruations. How the menstruations was starting. What are the hormones which are taking play in the formation of this menstruations, and all that those things were described in the same way. How the testosterone hormone was produced in testes, and what are how the sperms are developing and where they are developing inside the testes. All these things has been described systematically. And after that, in the mother's womb, that was a big phase, big important thing which everybody knows about, that whether they know the simple minute things about that one, but everybody knows that when the life is developing in mother's womb, the abdomen is developed. They just see, everybody can see that. But what happens inside, I have described everything from the day one, when this fertilized ovum, when it meets in the fallopian tubes and becomes fertilized, and then it enters into the mother's womb at 21 days of its life. And after that, what were the changes taking place inside the uterus, inside the mother's womb, how the placenta, the all was formed, how the umbilical cord was formed, and then how the food was transported from mother to the fetus as well. And first of all, for the embryo and then the fetus, the name was changing time to time ultimately. And then after that, how this body was structured inside the body, time to time, what changes were taking place, and how the total structures, and when it was completed. And so that was the 20th week of pregnancy. I have told you about that one. And then after that, development of all the organs in their normal functions. That is 32 weeks of the pregnancy. And then after that, I told you about development of this complete body up to the 40th week of pregnancy. And then the labor was starting. The function of the uterus, it was the important thing at that time. When I was discussing this development of the fetus, I have described you about the formation of the uterus, then the function of the uterus, and especially the inner layer of the uterus, that is the endometrium, which was converted into decidua. Because the first of all, normally it is known as endometrium, which middle layer is known as myometrium. The outer covering is known as broad ligament or perimetrium. So all these things were described one by one, and what were their functions, what they were doing, how they were helping to develop the life. All these things I have described in these lectures. And then a phase comes after details, because the importance of the decidua comes in existence when the pregnancy starts continuing and developing inside mother's womb. At that time, the role of the inner layer of the uterus was very much important. Time to time, it was playing a full role for the development of the fetus and giving space to the developing fetus and all other things which were going as a complications to this endometrium. Not only this one, but as a complication of this developing fetus, complication of the placenta, complication formation of the umbilical cord, and also this decidua, and decidua basalis, decidua capsularis, and decidua vera. All the three types of this inner layer of the uterus was having big importance in the development of the fetus. And I have told you about those things in detail, one by one. Many lectures were given on this thing. Then ultimately stage comes when this child comes out of mother's womb. When it comes out of mother's womb, that is known as labor. Why this labor was initiated? when a child was living and normally in a mother's womb, mother was feeding him, mother was taking care of everything for him. Then why? What was the necessity to come it out? So I have described about that thing, and ultimately that started because of those reasons, hormonal reasons, and space deficiencies, and many other things initiate the labor pain. And this labor pain I would describe in detail, because that's the big thing. That's you can say every woman during labor uh, passes into a new life. It's very difficult. Sometimes in previous life, when there was not much arrangements in the medical science, though it's a natural factor, it's not a disease. Pregnancy is not a disease; it's a physiological phenomena. But even then, a resolution of this pregnancy into delivery is not a simple thing. And ultimately, with the complications, there were many more complications falling during the first stage and second stage and third stage of the labors, and the ladies were dying, and even the babies were dying at that time. Why they were dying, what were the conditions at that time? So all these things I have described one by one. In the first stage, if the labor is delayed, what's the period of that the first stage of labor? Then the second stage, what's the limits of the second stage, and what happens in that if it's not going normally, what may be the complications, and how you can get rid of those things. In every stage, complications for delaying of the labor I have described, and how you can get rid of those things I have described. Placenta previa was the main complication at that time, and I have described you about that one. Partial placenta previa or complete total placenta previa, and what are because nowadays there are many more other things we can do. Technology has developed to the extent that before the labor starts, before that period comes to in its phase, we know that. And if we know that, we arrange that. And if we want to arrange that, we have many more measures like cesarean sections and many other things with which we can save the baby, which we can save the mothers as well. And but previously there were many more deaths, and even mothers were not surviving, and the newborn was were dying during the labor periods because of the lack of knowledge at that stages. But nowadays we are competent. This medical science is competent to resolve all those issues time to time, and now we are capable of, if there be any complication at any stage of labor, we are able to tackle that one. And now there are very few deaths under such circumstances, and only on those areas where this medical science and the knowledge of the medical science at this time has not developed fully, or the means adopted in civilized societies and developing countries are not over there. So in this way, this may be happen still may be happening in those countries. But actually, now we have overcome this normal phase, normal process of the life, how the life was created and developed and coming out of the mother's wombs. And after that, we have discussed about the complication to the mother as well during that phase. What type of means we have adopted, forceps delivery or episiotomy or whatever, or the cesarean. And after that, cutting of the umbilical cord. And then after that, the complications to the mother at that time, but may happens. A heavy bleeding may be there, or some tears may be there. Many other complications we have discussed time to time, and how to resolve those things, what to do for that. I have discussed each and everything in these lectures. And after that, the complication to the newborn. First of all, the inspection of the newborn. How will inspect him? Inspection means we assume that when a child is born, it has everything in complete body. But it has been learned nowadays by the medical science that no, childs are, when they are born, they are not clean. The newborns are not complete in their whole existence or structure of the body. So that we have to find it out. Some of the things naturally or physiologically are completed later on in due time. that we take it as a physiological, no problem. It's not pathological. But some of the conditions, when in a limited period are not completed, that causes, that attracts the attention of medical science nowadays. Then how to correct all those things, which immediate needs attention, just like phimosis, just like the meconium and all these things. If they are not passing, mean the first stool of the baby is not passing, it means something is wrong in the intestine, digestive canal. Or if he is not passing the urine, it means something is complicated in the urethra or somewhere else, that we have to find it out. And this way, many other complications we can see, just like cleft lip and cleft plate, and all those things I have described you. After the child is born and we inspect the child, because of some deficiencies we see, which are known as anomalies, I have described about those things. And even most of the things I told you about, that we are now able to detect all these anomalies even on 13th week of pregnancy in the mother's womb. And now most of the things we are able to correct that in the mother's womb before to complete 40 weeks of pregnancy, means before the 280 days of intrauterine life, we are now able to correct all those abnormalities which we detect in 13th week of pregnancy. And we are able to, but some of the complications, some of the deficiencies in the structure formation of this fetus, we are not able to correct those one. Those are known as some types of genetic problems. And in this way, the child born with those things. And sometimes the doctor advice, sometimes doctor advises that this child is not complete in its structural formations, and it will be a complications for you lifelong, or even it will be a complication for himself as well. So it's better not to deliver this child in a full term, but better to abort this one. And that is known as MTP, medical termination of pregnancy. And with the advice of the doctors, and the parents sometimes agree to these conditions, and they go to MTP, medical termination of pregnancy, with the suggestion of the doctors. But when we assume that every child who is taking birth in mother's womb, is developing mother's womb, inside that one, will be healthy, will be normal, and all that. But if there be complication, we are now able to correct those complications inside that. But sometimes it is not. So all these things we have discussed one by one in all these lectures. And after that, the first stage, when a child is born for 1 year, uh, we take it as a newborn. The label is marked on it that it's a newborn. And the newborn child has many more complications. The first thing, first of all, the food was supplied by the mother, and it was according to the need of the fetus at that time, automatically known need. And the mother was supplying that food, that type of food. And even if a mother is taking any medications and anything else which is not required by the baby, and which should not be given to the baby, placenta is a barrier. Custom department, I told you about that one. The placenta is a custom department that blocks those things not to go to the baby and go back to the mothers again. And in this way, all these things were saving the fetus in mother's wombs. But here, after the birth, there are different kind of complications that this life has to face. And most of the children were dying in the first year of the life because of these diseases, just like the tetanus, just like you can say measles, mumps, varicella, influenza, polios, many other things were happening at that time, and hepatitis, all these things I have described one by one. But now the medical science knows about those things, that these are the hurdles in life, and how to correct them, and how to take care of those things. Now we have developed the vaccination phase, and that vaccination is now adopted by various countries for their populations as a whole. And some of the countries are still lacking all these things, and they are unable to provide these type of vaccination in a routine to their community. And even still, the children's newborn children are dying over there, and even mothers, because lack of the management at that time after the labor or during the labor, mothers are still dying in those countries. But in developing countries, there are big arrangements at this time, and the mortality rates have come down for that one. So all these things I have given you the details, and after that I told you about after passing the first year, what type of vaccinations we are giving to them, and we limited that vaccinations time to time to provide the doses of those vaccinations. It starts from the first to second month of his life after birth. First to second month, within first to second month, hepatitis vaccination is given, because the first thing happens, food is changed, and foods had to pass through the liver, so that suitable things with the required things should go into the circulation. Other thing should be resolved issue over here and blocked here in the liver, just like the cholesterol, just like the fat or sugar, and all these things which are going to the food, because food is totally new. And the system, intestine or all other systems, they were not working, because they were not required to work at that time when it was in a mother's womb. But now they are required to work, and they immediately start after that, after the birth, and they are allowed to work, or even they are deputed to work. Oh, now you have to work it. And ultimately, under those conditions, it becomes very difficult for the, even without orientation, you can say, if you depute any person, if you point any person without orientations on a duty, I think he will not be able to perform it perfectly. So in this way, this is the condition. This happens with the children's at that time, that environment, food is changed, and the system is not learned to this new type of change of the foods. Second, environment is changed. He was not breathing himself. The breathing or the oxygen was supplied by the blood from the mother, and now he has to breathe in our environment, which is different from the mother's womb. I told you that 480 mm of mercury pressure is in our environment, which it was not existing in the mother's womb when the child was in the mother's womb, because the abdominal muscles of the mother, yeah, muscles of the uterus were taking care of this pressure, and this pressure was not reaching to the fetus at that time, and the fetus was moving in the mother's womb freely. But now when it comes out of mothers, immediately this pressure falls on it, and he cries. Though with this cry, there are many more things which happens for good, just like the opening of the this lungs. They were squeezed at that time, just like a football bladder. But after the pressure is put down, the child cries, and by the force of the environment, air goes in. They are opened. And ultimately, with this one, there are many more things that happened into the heart and circulation to the pulmonary circulation, that is known as, when the blood was not going to the lungs, because the line was blocked. But now the lungs are open, and the circulation start from the heart to the lungs, from lungs to the heart, and then go to the system. Means which oxygen was provided by the mother in the mother's womb at that time, through the blood, it is now supplied by the lungs from our environment, and that new system starts at that time. So first thing, food changes. Second thing, this circulation of air, or uh, accepting the environmental air, it changes. Third, our environment totally is changed from where he is getting the airs. So all these things are totally changed, and it puts big pressure on the newborn baby's system, and all these systems are bound to work. And ultimately, you might have learned that newborn babies have uh, jaundice, pelia, you can say that they suffer from the pelias, because there is a big destruction of the hemoglobin. Big distraction, which was not previously, because previously the food was supplied in a normal quantity, which it was required by the child at that time. But now, there is a different quantity We are pushing food to him, and from that food he has to prepare the blood. He has to prepare the calcium, magnesium, whatever is required by the body. He has to synthesize it from that dose, and this way a big pressure falls onto the systems of the newborn child, and ultimately, when the iron, especially food we give by mouth to the child, goes to the intestines, and ultimately, this from the intestines go to the circulations, and from that it is also supplied to the intestines. It's also supplied to the heart. It's also supplied to the lungs and everywhere. And when this circulating blood is supplied to the first of all, it was a mother's womb. When he born, it is a mother's womb. It was a mother's blood. It was circulating into the system of the baby and goes to the intestines. From the intestine, whatever blood goes to the liver, not directly to the heart. Just like I give you the example that mostly we learned that circulation from heart to each and every tissue, from tip of our tongue, tip of the fingers and the toes, all that, and from toes it goes back to the heart. This is the normal routine. But I told you about this one, that the blood which goes to the intestine to supply the oxygen to the intestines, that does not go directly to the heart. From anus to intestines, it does not go directly to the heart, it goes to the liver. And whatever iron it contains, it is breakdown in the livers, and that breakdown of iron converted into bilirubin and biliverdin in the livers. All the components, whatever the blood is coming from the intestine to the liver, is breakdown into different their components, and iron is break down into bilirubin and biliverdin. And excess of breakage of iron at that time, because maybe the child is having Rh positive father or mother is Rh negative, sometimes it's very difficult for the survival of the child. I described this detail in that one, and sometimes the children die within a few days of the birth because of this one. And even stillbirth, at the same time when they born, they die because the excess destruction of the hemoglobin is converted into bilirubin and biliverdin, and that biliverdin and bilirubin are going to the circulation, and there is a big jaundice. Yellow eyes, yellow tongue, yellow nails, and everything is converted because there is a less oxygen, there is a less hemoglobin, and everything has been broken down, and ultimately children die. But nowadays we have mayas about that one. Even if the mother is carrying a baby who was having the father with a positive Rh positive factor. Sometimes now we are able to detect it beforehand, and we are able to transfuse the total blood of the child. So these are techniques we are adopting nowadays so that a child can survive. But I'm describing the normal phenomena of all these conditions, how it was happening when we were not knowing about all this transfusion of the total blood and changing everything in these conditions. So ultimately it happens, and nowadays most of the children have jaundice, but that breakage of the hemoglobin is covered up, is managed within a week or so. Sometimes it may be little linger on. After third or fourth day, we see a visible changes on the face and everything, and we assume that if we give this child direct exposure of the sun and maintained by other feeding things, ultimately it is recovered within a week or so, maybe 2 weeks. But if it's lingering on, we need to manage this thing by active medical measures. So in this way, I told you about this thing, how it happens when a child is born, and in the newborn stage, he is having jaundice, and how you have to manage that one. What are the medications? What you can do that? I described all these things in my previous lectures. And after that, I told you about the other complications and other type of vaccinations, and then it passes 1 year's level of newborn and reaches to the toddler's age. And the toddler age is far about 5 years. And up to 5 years, this child has many other complications. Some of the complications which he adopted at the beginning of his life from 1 years are continuing. Some of the managements which we are doing at the first year of his life, that the vaccinations, we are still continuing, and we are continuing up to 14 years of age, because the booster dose of all these medications are given up to 14th years of age. And I have described about all these vaccinations time to time and many other lectures even, but in a routine I have described what are the vaccinations, when their doses are given, how long their doses are given. And after the passing of 14 years of age, when the booster doses of all the vaccination has been given, after that, what are the instructions about some of the vaccination, just like the tetanus, just like the measles, all that time we have some other instructions that they can come up on the system later on in the life, but with the changed name, just like the shingles we know it. In this way, all these things described in this phase, ultimately the phase it developed up to the adolescence age. And the adolescence age start after 7 years of age, and then continue on to 14 years of age. And there were many more complications, and strange things happens. A girls may converted into boy may be converted into female girls, because of the fight which is going on with the genes of X chromosomes and Y chromosomes, and that fight shows the results even in the mother's womb. After that, at the time of birth, we see that when after that, at the adolescence age, we can see all these changes can happen in this way. I describe all these things in detail, fully, so that everybody can understand what happens, how it happens, what are the reasons behind that. All these conditions I have described you. After that, we develop this life up to the pre-adult age. And pre-adult age, what are the complications at that time? And there were big instructions for the parents. I gave 2 3 4 lectures about this one in a routine, that this phase is mostly concerned with the parents. Parents should learn at that time, because now the management of the parents is changing. Now the behavior of the parents should change as per the age of the children's. They are converting into adult age. At this pre-adult age, we should be more intelligent. We should be more careful by behaving to the children's. And all these things I have described in these lectures at that phase. And after that, I was thinking that now this body, this structure has developed, assumed it is full, though there are still deficiencies, but assumed it is now fully developed body. And what is the main single unit of this body from where it has developed? That is the single cell. Sperm and ovum were not single cells, they were diploid cells, and when they meet with each other, they become a one complete cells. And from that, the complete life of the complete cell starts developing from 1 to 2, 2 to 4, 4 to 6, 6 to and 12, like this one, it was developing. But the basic unit of this development of this whole structure of the body remains same. And what was the structure of that cell? I describe you in these lectures. I told you about the cell structure. What is a cell? What is the structure of the cells? What are the components inside the cell? What is their duty? What they do for the structure and functioning of this body living inside the cells? So all these things I have described you. And after that, I started developing this skeleton. The first of all, this whole body after the cell, started describing this whole body structures. And we started it from the head. We started from the head. that this head globe is formed by seven different bones, and I describe you about the seven different bones: frontal, the occipital, and both on the top of this parietal bones, sphenoid bones. And this way, then after that, the 14 bones were concerned for making this face, and all these ethmoid bones, which is not visible from outside, but most of the bones are visible inside: mandibular, maxilla, palatine bones, and the nasal bones. All these things I have described you one by one, and what's their role, what they do, what's the importance. All these things after discussing in my lectures, and then we came to the explanation of this neck, how this neck was formed, what are the structures of the neck, what are the basically bones. Now, not the structures we are not discussing. We are discussing this bony structures, which are forming the structure of this body and skeleton, you can say, in other words. So after describing this neck, we I have described you about the backside, that is foramen magnum and atlas vertebra, and the vertebra from first to seventh vertebrae in the back sides. And in the front side, I have described about the hyoid bone. I have described by the trachea and their functions, what they are doing when they are situated in the neck, where they are situated, and what they protect, what they do, what is the usefulness of trachea, what the usefulness of hyoid bones. All these things I will describe you in these lectures. And after that, we have reached to the chapter of the chest. And everybody knows there are ribs. Everybody knows in the backside there is a vertebral column. Everybody knows that there is a sternum in front, but still it needs to be described in detail, that how the ribs are not all the ribs are similar, not all the ribs are in the similar structures, and their number is also different. In this way, in short, today we are describing this basically 1 to 7 ribs. These are actually known as true ribs. True ribs means those who are attached directly in the backside with vertebral column and in front with the sternum. The bone you see in front after the neck. After the neck, the first bone which you see, that is known as clavicle. Husly, clavicle, which starts from here and goes to the shoulder. And ultimately, there are two clavicle bones, one on right side, one on left side, and these two bones are not uniting each other. There is still one other bone. There is still one other bone that is known as manubrium sterni, and that manubrium sterni has holes, three holes, basically three holes, and two holes, two clavicle bones on both sides are attached, and the third hole downward, where the body of the sternum. Basically, this is known as manubrium sterni, means a part of the sternum, but it's the upper part, and it has a T type shape, and underneath there is a hole with which the sternum is joined, and the sternum is the body, is the bone from that portion up to the xiphoid sternum, where you see the ribs are separated, and there is a gap, a dip in the end. After that, the abdomen starts. Before, between the abdomen and the chest, there is a dip, and that is known as a xiphoid process, and that is cartilaginous in the beginning, and after that, at the 50, 60 years of age, it becomes bony. So between that period, the shaft, that is known as shaft of the sternum. So in the back side, vertebral column, we will describe it. In the front side, there is a sternum, and the sternum has three portions. The upper one is Manubrium sterni. Middle one is the body of the sternum, which holds from first to seven ribs, not all the ribs. And it is without clavicle. Clavicle, the upper portion is separate. After that, seven ribs are united to the sternum. In front and backside, all the seven ribs are united to the vertebral column. And at the end of these seven ribs, there is a dip. And most of the ribs are attaching to each other, because we have told you 12 pairs means 12 right side, 12 left side. So we have counted 12. It means five bones are still lacking. Out of five, three bones, three ribs, you can say, three ribs are attaching to each other, not to the sternum, to attach to each other and making a dilatation, a gap of the chest, because the abdomen is dilated. Abdomen may be gas formation and whatever it is, and it's dilated. In those conditions, nature has provided a gap by adding the ribs, three ribs, seventh to eighth, eighth to ninth, ninth to tenth. Means 8, 9, 10. Three ribs are attached to each other, not to the sternum directly, on both sides. On both sides, these are attached to each other, just like a holding hand of one person to the other person to the others. And ultimately, the first seven persons are holding the actually pole. Actual pole, seven persons are holding. After that, three persons are holding each other. One of them is holding the hand of seventh one. The eighth one is holding the seventh one, and ninth is holding the eighth one, and tenth is holding the ninth one. So in this way, it becomes a gap, a large portions of the chest. In this way, these ribs are attached to each other, so that a big gap downward is given for the distension of the abdomen, for the development of the, because abdomen is a flexible thing. It may be distended, it may be shrinked. In whatever way its position is, these ribs, the lower ribs, and after that I told you about 10. The two ribs are known as false ribs. False, basically, these are not false, these are bones. But we say them false because they are not attached in front. Just like I told you, the eighth is attached to the seventh, ninth is attached to the eighth, but the tenth is attached to the ninth. And after that, 11 and 12, they are not attached to this one on both sides. They are only attached in the back side with the vertebral column. So that from front side, it can open. Front side, they can dilate. Whatever the capacity of the abdomen is, they can dilate to the maximum capacity, because they are open from the front, and they are united with the vertebral column in the back side. So this is what I describe you about the bones of the this one. So just like I told in the beginning, 1 to 7 are the true ribs. This is just to remember it. All are ribs. 1 to 7 true ribs means these ribs are attached to the one body, one pole. One pole. All the sevens are holding that pole directly on both sides. And from 8 to 10, these ribs are false ribs. They are not directly attaching to the pole of sternum. They are not attaching to the pole of sternum in the middle of the chest, but they are attached to each other and making a gap more wider of the abdomen and are attached in the backside to the vertebral column. And after that, these are known as false ribs. And then after that, there are two still more, which are not following this pattern. The pattern is true rib attached to one pole of sternum, three ribs not attached to the pole but attached to each other, and two ribs, they are not attached to this pattern. They are floating ribs. They are known as floating ribs in abdomen. Abdomen can distend, abdomen can squeeze, and they allow it. And they move like that one. So in this way, this forms the structure of main ribs. And I told you about the Ziegfeld process. I told you about the manubrium sterni. I told you about the sternum, the middle portion, main portion, which attach the seven ribs. And after that, it's not done. It is not done that the chest is complete. Backside, we will describe the vertebral column. We have already described that there are seven vertebrae in the cervical area and the neck area, you can say, and 12 vertebrae are in the chest area, in the backside. And but remember, those 12s are attached with the ribs. But in front, all the 12s are not attached with the sternum. Front, there is a different. Backside, they are attached to the vertebral column. And vertebral column is basically our main pole for hanging this skeleton. This is main pole. So main pole is having attachment of all the 12 ribs on right side, 12 ribs on left side, means all the 24 ribs are attached to the main pole, but their attachment or their detachment is a different in front. That is why 1 to 7 is known as a true rib, 8 to 10 are known as false ribs, and 11 and 12 are known as floating ribs. And after that, all the ribs in front or back, they are having a cartilage. Cartilage means a structure which is not converted fully into bone, but it is like a bone, and they are like a this is known as hyaline cartilage, a structure which may be converted into bone but not. Nature needs the flexibility, maximum flexibility of the structure, but the components, they are having like a bones. Components, they are having like a bones, but they are not the bones. And they help to unite the bones with the other main structure. Just like first to seven bones, when they are uniting with the sternum, there is a cartilage. Costal cartilage. That is, costa means rib. Costa is the name given to the ribs. Costal cartilage is a structure of cartilage between the sternum and the ribs, which unite these two things to each other. Bind, you can say the bind. They bind each other so that there should be flexibility maintained. In the chest, we breathe, respiration, inspiration, expiration, inspiration, expiration. We do that. In this way, the chest is also flexible, but not flexible according to our abdomen. It is not flexible according to our abdomen. Our abdomen is more flexible. Chest is less flexible. And in this way, these costal cartilage, costal means rib cartilage, which are attaching the ribs with the sternum, or in the backside with the vertebral column or the vertebrae. There is a space. There is a space in the vertebrae, and with which these ribs are attached over there. And this is known as costal cartilages and the hyaline cartilage. Hyaline cartilage is a specific type of cartilages which are more flexible but which are more strict. This is a type of, you can say, ligament, a rope type with which you can fix any two solid materials. One side is sternum, the other side is a rib. Two solid material joints by means of hyaline cartilage, which can support both of them and which gives the flexibility to distension. In this way, this our chest is able to move. And cervical, back side there is a scapula, front side there is a clavicle bone. They are attached to the shoulder. This is known as shoulder girdle, or back side is the shoulder blade, that is known as a scapula. In front side, these are the clavicle bones, and they are uniting and making the shoulder blade. Shoulder girdle basically is known as shoulder girdle. So in this way, mostly the joint where the ribs are joining with the sternum, its color is red. Mostly the cartilage are pale and glossy, and the hyaline cartilage is a specific type of cartilage. They are red in color. So there is a little difference in the color of that one, hyaline cartilage, and the structure that is the costal cartilage. They are different in structures. Costal cartilages has less movement and more strict, more hard. As to the hyaline cartilage, they are translucent and they are colored having red. So this is what we can say you about the chest structures. And tomorrow the same thing will be repeated in Punjabi. If you are unable to understand this lecture in English for the structural formation of this body, I will describe all these things in Punjabi tomorrow. And at that time, Radio Parvaz will be joining us from New Jersey, and you can listen that. This is Gurdeep Singh Sandhu, your homeopathy consultant. My clinic address is 9701 Sarah N. Court, Dublin, California 94568. Phone number 408 687 1899. Email address homeomedicine homeomedicine@yahoo.com. HOMEOMEDICINE at yahoo.com. Anytime when you are tired of any treatments or suffering for any disease at any age, and you want to get rid of that one, or you want second opinion about your disease, you can call me 408 687 1899, or you can send your message on the email. You can get your answer. The best suggestion based on my knowledge, I can give it to you. There is no consultation fee for any persons from anywhere. You can call me to get your second opinion about your disease. And even if you want to be treated by a scientific homeopathic approach to your health, you can call me from anywhere around the globe, or you can send me email about that one, and I can consult you on phone, even FaceTime, because nowadays media is advanced. Media is advanced, and we can see you face to face, just like you are sitting in the doctor's office. You can on FaceTime, you can see me just like you are seeing me on Facebook at this time. The same way we can discuss about your disease, and your medicine will be mailed to wherever you are in any country after that one, to the best of my knowledge based on this one. So, last request to all of you is that if ever you think these lectures are beneficial to you, it is something unique, giving you a knowledge, then please convey this message to all your nearest and dearest, so that they can listen also. They can join Facebook friendship with me. They can join my YouTube channel, or they can download the app of Sabarang radio stations and can listen all these lectures. If even they want to listen the previous lectures, as I described you everything, because everything is in my mind, and whatever I have described in my previous lectures, if they want to listen it and come to the complete knowledge of this body, this life, and everything, then they can join my YouTube channel, Homeo Medicine, and then they can listen all those previous lectures, my YouTube channels. Okay, so Rab Rakha, God bless you all. We'll see you tomorrow in Punjabi channel, in Punjabi media for these lectures. Sat Sri Akal, Adab, Namaskar.